Hi, I'm Dr. Andy Storm from the Mayo Clinic in Rochester, Minnesota. And on behalf of my colleagues and co-authors, I'd like to talk to you today about our new paper in gastrointestinal endoscopy titled Initial Multicenter Experience Using a Novel Endoscopic Tack and Suture System for Challenging GI Defect Closure and Stent Fixation. On behalf of my colleagues here in Rochester and across the United States, we're excited to tell you about it. Prior data suggests that closure of larger mucosal resection sites, particularly greater than 2 centimeters, in the right colon and for patients on antithrombotic medications may be of benefit to reduce bleeding risk. Our study was designed as a retrospective multicenter U.S. study to evaluate the feasibility and safety of the initial use of a novel through-the-scope tack and suture device for large and challenging defect closure, as well as for stent fixation. Use of the device for mucosal defect closure is shown, whereby 4 surgical steel tissue tacks are placed in series with an attached 3/0 polypropylene suture. After placing the tacks through a Persian drill mechanism, the suture may be tightened, drawing together all of the tacks and then cinched to secure the construct. Stent fixation may proceed similarly with tacks placed in series between the upstream gut wall and stent flange to serve as a stay suture with the goal to prevent premature stent migration. In total, 93 patients were included in the study. Technical success was achieved in 83 patients, or 89.2% of cases, including mucosal defect closures with a mean size of 41.6 millimeters. Closure with an alternate device, including through-the-scope clips, over-the-scope clips, or traditional endoscopic suturing, was determined not to be possible in 24.7% of cases, highlighting the benefit of this through-the-scope suturing tool. Adverse events were non-severe and occurred in 2 patients, over an average follow-up of 34 days. We concluded that the novel endoscopic through-the-scope tack and suture system is safe, efficient, and permits closure of large and irregularly shaped defects that are not possible with other established devices. Thank you for your interest, thank you to our collaborators, and thank you especially to the editors and reviewers of Gastrointestinal Endoscopy.